Hello everyone, this is your host Rohan Tandel from InnoHealth Magazine Studio. I welcome you to this podcast produced by Innovation Figures with a mission to spread awareness and knowledge of various facets of healthcare innovation. This podcast is 12th in the series Voices of IC Innovator from InnoHealth Magazine, the first magazine in India on healthcare innovations. In this series, we would be exploring the essence of the IC Innovator Club through club members' perspectives. Today, we are going to have a conversation with a guest speaker, Dr. Pushkar Kumar, who is a physician and has over 20 years of experience in the area of public health, having served in the government, NGO, and private sector. He is working with PHFI as a senior public health specialist and heads the training division, which is working for capacity building initiatives for primary care physicians and healthcare professionals in clinical conditions, and various public health domains for the last 6 years, which has trained more than 36,000 healthcare professionals across the country. Welcome, Dr. Pushkar, to our podcast. How are you today, sir?
Thank you, Rohan, and very good morning to all of you. All fine.
So, now coming to the podcast, let me elaborate on the flow of this podcast. I'll be asking you a series of questions and we may discuss your views on it. So, let us begin. So, as we know, we grow in our career with the help of various experiences, be it good or bad. Those experiences bring in some important lessons. The realization of such lesson depends on the person. So my question to you is, what is that one thing or that one lesson that you wish you knew at the start of your career, or say you made a realization of which after many years and would have preferred otherwise?
Rohan, to answer this simple question, basically, I am an MD pathology, basically, but I wish in the beginning of my career, I would have chosen the public health field in the future. And after my MBBS, I did work in public health and the field of pathology and blood safety before migrating to public health in the last 15 years of my career. So this would have been much more because the human resources of health management, capacity building, these were the prime area I've been working in the last 10 to 12 years completely. This would have definitely given me a better insight into my career in public health.
So coming to the next question. Through our life and career, we may use many things as stepping stones to grow and develop, to be the ideal personality or role that we want to play in our future. Some of which enabling us to take a major leap due to its deep impacts on our mind. So my question to you is, what are the resources that had a major influence on you as a professional or as an individual?
I will say my 8.5 years spent in the medical school, my MBBS and MD was the best. The best, and that was the measure. The whole theory and the practical training I spent in the medical school was the main one prime influence. The mentors and guides in my extensive 20 years career. And the third key thing would be my 6 years roughly spent in maternal health division in the Ministry of Health and Family Welfare. Because from the sub-centers to health and wellness centers now to the medical colleges, I have traveled wide to all these states, 36 states and union territories, from the field to the tertiary institutions. And that has been the key influence to guide my career.
Going ahead, like resources, we come across many personalities whose life decisions or maybe passion towards their career or any other attribute want us to mirror those personalities. So I would like to know which person or who are the people you idealize and why.
First, I would like to mention Dr. Himanshu Bhushan. He was a deputy commissioner in charge of maternal health division in Government of India and my head of department in the ministry. And currently he heads the PHA division in National Health System Resource Center, which is the think tank of National Health Mission. His passion and commitment to the work, though he is now 65 plus, I think he spends roughly 16 to 18 hours planning for the public health grassroots to the top level. How does it influence the country? And he has been a major influence and guiding force in my field. Secondly, Professor K. Srinath Reddy, my president at Public Health Foundation of India, being a cardiologist and an epidemiologist, the vision in public health, which Professor Reddy influences, that guides, I think, the public health arena in India. And I have been definitely influenced by his vision as well.
Those are some great visionaries. So now coming to the next question, talking about careers, many people face various hardships. So I would like to know some of the hardships you faced in your career and how you found inspiration from such situation.
I came to Delhi in the year 2004 after completing my MD. And that was a time when I went to nearly all the government and private hospitals in Delhi to look for a suitable placement in the field of pathology and lab medicine. And I think it was not easy to get into the first career field when I migrated to Inspirational Apollo Hospital and entered the blood safety field. So that was maybe a defining phase. And from then onwards, I shifted to the Public Health in National AIDS Control Organization in the year 2007. So those 2 to 3 years was really a time when I was really thinking on how to go ahead. But I think the hard work and the learnings from this has definitely influenced my travel ahead in this career in public health.
Coming to the next question, besides your current profession, what profession would you like to explore given the time constraint?
I believe medical field is the only profession I would have chosen. There will not be anything, but my interest does lie in maybe reading and writing. So as a writer could have been a second option, maybe post-retirement. Whenever I get this chance, that could be a field I may choose an alternate.
So that's a great profession, I guess, and I hope you get the time to do that. And I would like to get to read those writings that you would be publishing later on. So coming to the next question, what makes you feel your best self? Say, rejuvenate you from the daily workload and stress.
I believe reading is one habit I have inculcated since my school days. And whenever I get time, I do prefer reading, from newspapers to journals to novels. Of course, fiction is my choice. So reading and driving is again a passion. So these are the two hobbies. Whenever I do get time, I do try to explore, even now after a hard days of work or in the weekends.
Coming to IC Innovator Club, I would like to ask what it means for you to be a member of this club.
This is a prestigious institution and club membership, which as a PHFI, we are a part of. And I think the biggest advantage is the sharing of experiences. The technology is the future now. So in the light of the pandemic, I think the world and the public health arena has also changed a lot. So experience sharing among the peer group, the experts and the top-notch industry and the government people, I think that would be helping us keeping abreast of the latest changes. And as PHFI and at the training division, we are proud to be a member of this IC club also.
Moving ahead, as we know, the definition of innovation may be same for everyone, but the meaning, the value of that word differs from person to person. So my question to you is, what does innovation mean to you, considering the healthcare industry?
Innovation in the health sector or would be any new product, a process, an output, an evaluation, any initiative which would be an improvement over the traditional way of thinking. That would be called innovation, and health industry definitely needs innovations because you need to take abreast, move ahead with the times. A lot of changes, both technology has moved ahead, and if we are not keeping up, it would be very difficult to be in knowledge. And being a part of this Innovation Curious membership, this club, prestigious membership, it does give us a big advantage to be in the current and know-how.
So for my final question, I would like to ask, where can our listeners connect with you?
I head the training division at PHFI, and my email ID is pushkar.kumar@phfi.org. And all our PHFI websites gives us the great list of training programs. We'll train doctors in the field of diabetes to mental health to disaster management, and name any field in NCDs, communicable diseases, health program management. So we are at PHFI training primary care physicians and doctors across India, working with 26 state governments, as well as with 10 other governments in Southeast Asia, 10 other countries in Southeast Asia and Africa countries. So our training programs are the biggest, and the websites of each of them are mentioned in our website, phfi.org. Thank you.
So the link to connect with the guest will be down in the description. Also, the training links that Dr. Pushkar talked about would also be down in the description. So before concluding, I would like to thank Dr. Pushkar for joining with us on this podcast. Thank you, sir.
Thank you, Rohan. It was a pleasure from my side as well. Thanks.
To conclude, I would like to call out to our audience to leave a comment with a review and let us know whether you like this podcast. Drop down a comment if you have any podcast ideas or recommendations. You can also connect with us if you have any podcast idea or any healthcare journey of your own to be a part of our podcast series. And for more such content on healthcare and innovation, visit innohealthmagazine.com. Stay safe. Goodbye from your host, Rohan Tandil from InnoHealth Magazine Studio. Thank you.